Dragons. 105.1 The Buzz with Daria, Mitch, and Ted.
Okay, ready?
I'm ready.
Dun, dun, dun.
Happy birthday to you.
Happy birthday to you. Happy birthday, dear Mike.
Dr. Workman.
Dr. Workman.
Happy birthday to you.
Couldn't quite get on a key, but we meant it.
Wow. That was perfectly on.
Is today your actual birthday?
No, Sunday.
It'll be Sunday.
Is it Saturday or Sunday?
Sunday. Yeah, you got a good memory.
Oh, and so we've spent at least 7 or 8 years with you.
Wow.
Here on the stage.
My
Isn't that
eyes are
crazy?
almost watering. I mean, I love having my birthday song sung. I really do.
That's so sweet.
Isn't that adorable?
Yeah, I picked
you
myself here.
you are the rare person that loves birthdays. That's not a little child.
Oh.
Do you have big plans for your birthday?
We're going to the Seahawk game on Friday
fantastic.
night and then spend the weekend in Seattle.
Yeah, have
Excellent.
a nice dinner and
Yeah, probably go to Metropolitan Grill maybe.
have a little cake sent out.
Yeah, a little cake.
They'll sing to you.
Candle on it.
Oh, yeah.
Oh, he'll be disappointed if they don't sing. Okay, so
And we said who he is? Dr. Michael Workman?
Oh, yeah.
Cosmetic surgeon.
Dr. Workman, happy birthday to you. So I have been in contact with Dr. Workman's wife, Carol, because we love her and
The lovely,
my family
wonderful,
loves her.
amazing Carol. Also a doctor.
Also a doctor. She looks like young Barbara Eden. My Dream is Jeannie, quite a bit, and I think that she knows that. She'll go on vacation and people are sure that it's Barbara Eden. She looks that much like her. So she's like, I was wondering about. You may remember, like some weeks ago and some months ago, Dr. Workman was telling us about a new procedure that's an alternative to liposuction, but kind of similar in that it's good for spot treatments of fat that aren't like massive, like it's not a big weight loss thing. It's just maybe
I can't get rid of this last little thing.
Here's the thing. In my own situation, when I gave birth to Xander, I bounced back pretty quick, except for this one roll of fat
That's very common.
above my belly button. And I would exercise, like actually, not just the thing where I say I'm going to exercise.
We know.
Like actual exercise, and the rest of my stomach really flattened, and this one area
So it can go away.
it won't go away, and it's just I can't. It's fat, and it's staying, and it's fat,
And that's
I
not
don't-
right.
I don't want to have liposuction because the procedures that I went through medically earlier this year, I feel like that's enough stuff
Being
stuck
poked
in
in,
me. I'm like I'm not really feeling it. So then when he first brought it up, Dr. Workman, that you can spot freeze areas, and it literally does freeze it, and then you jab at it, and then it melts away into your body. I mean, I know it's a little more technical and
So
complex.
are you
than that.
basically killing it and then your body's getting rid of it?
That's how I am picturing it happening.
No, it's called CoolSculpture, and it was invented by a Harvard dermatologist who noticed that kids that had popsicles in their mouths for a long time, the fat would actually freeze. They'd have fat atrophy, and he came up with this patented machine that basically it sucks the fat into a device. It looks like a vacuum cleaner. I mean,
Can I
really,
watch it happening, or do I want to be
Oh,
out
absolutely.
for this? What
No,
I'm
no,
saying
no,
is
no.
I'm going to get it done next week.
Oh, cool.
I'm a little freaked out about it. But
Oh, you love stuff like this.
I do, but this is kind of, I love stuff with my face.
Okay.
You can do whatever you want with my face. You can jab at it, like any kind of creams. If it hurts and burns, I'm like, put on more cream.
You like needles?
I like needles, I like all of that. But this is, because I don't,
This is so new.
it's so new, yeah.
it's really cool though, Daria.
Okay.
So it sucks into the vacuum cleaner looking thing, and then it freezes it.
It freezes it. You sit there for basically on a comfortable table listening to your iPod
All right.
for 1 hour. And the machine, sucks that fat up. It stays there, and basically it freezes the fat. And it's akin to if I were to come up and just kind of squeeze your arm, and just not quite that hard. If you just it's akin to having your arm squeezed, and then it freezes it, but you don't feel it being frozen per se.
You don't?
No.
Because that was a big concern for me. Because I love hot. I can be uncomfortably hot. But if it's even a little bit cold, then I'm just like, I don't like it. So that was my concern, is that it would be this intense, unbearable coldness.
Nope, not at all.
And
Not
you're
at all.
completely lucid?
Oh yeah, a lot of people just do it with Tylenol. I probably will give you a Valium
Yeah, I'm gonna need
ahead
a
of time.
Valium.
yeah.
We should probably all have one
But
for
I
this.
can be quite articulate, I think, in my own mind.
Oh, absolutely.
Well, everyone seems all right in their own
Here's what I'm thinking. I think
You
that,
describe it as you go?
We'll do a remote broadcast.
For our listeners,
Okay.
we could even videotape it if you want to, and then
Okay.
put it on the web. I don't know if you're comfortable with that, but I'm comfortable with that.
Well, if you are,
or at the
okay.
very least, we could take before and after pictures.
Yeah.
And then we can talk about the experience the next time you're on the show. But I think that that if it's something that works, I think people should know about it. And if it's a procedure that I'd like people to be able to know from a firsthand perspective exactly what it's like from beginning to end.
Is this something you have to do as the doctor of the office, or is it something your nurses do?
Well, I've got a new nurse. Her name is Na, and she's trained in this, and she specializes in doing that. I will see you. I see all patients and evaluate them because it's not for everyone. Some people need skin removal or conventional liposuction.
Yeah, but you know me so well, and you know my fattiness.
He talks about it all the time when you're not around. Let's talk about Daria's fat ball.
It's just above the belly button, and I hate it.
I know you do.
I hate it. And we
It's the
just
thing
went
that
to...
happens with it when you have a baby. You have the area stretches out. It's like when the elastic goes in your underwear band.
But I refuse it. I want to buy
wanna
new
replace
underwear,
that? Right, you want new
frozen
elastic.
style. Yes. And when we went to Maui for a bit there in July, and the pictures came back, and I'm like, when I had my bikini on, I was like, oh, I'm looking good. I'm 43, and then I got the pictures back, and there's my stomach and above the belly button, and then down to the thing.
What was that above the belly button?
How long before we see results?
Yes.
Well, you don't see the final result for 3 to 4 months. However, having had it done on me 3 times,
Did you do it to yourself?
no, Carol did it to me.
If I had a fat sucking ice machine, that's all I would do.
With one hand.
Yeah.
With the fat side with the
I'd have
other.
my ice cream and that machine.
Good Lord. I'd have one in the car. I'd have one in the riding lawnmower.
Okay, so but when it was done to you,
Yes.
what did you see?
I noticed the next morning when
You have it done on love handles?
I had it on the love handles, and I had a little treatment slightly further behind. I looked in the mirror the next morning, Daria, and I'd looked at this area for 20 years, and it was gone.
That's what I want done. That's what you need to do it. Like, this needs to be the greatest freeze of your career.
Turn it up.
We'll plug it into the 240 instead of the 120. What do you think?
Seriously. Dr. Michael Workman, you can find him at the website of the same name, drmichaelworkman.com. And, of course, you can link to that from our website as well. So if you have questions about this, I'm going to go through the whole procedure next week. I think.
No, you got to do it now.
No, I didn't
counting
like,
on
make
you.
any sort of. This was just texting your wife, basically. So actually, surprise! I'm going to be doing this next week, and we'll definitely take at least some photos, maybe video, and let you know what it feels like, what it looks like, and I'll be brutally honest about it too, as I'm sure you'd want me to be.
Oh, absolutely.
Like if I feel like this is kind of I didn't like it. It was kind of uncomfortable. Yeah, or it hurts too much. I'll totally tell you. Surprise, I'll do that too.
We can't handle the truth.
Ongoing saga.
And also, once again, happy birthday.
Oh, thank you so much. It really means a lot to me.
You know what I'm going to give you for your birthday?
I don't know.
My
Some of your
fat
fat?
Non-stop buzz music. 105.1 The Buzz.